Hello, everyone. Thanks for joining us today. I'm Navjeet Kaur, your NDP candidate for Brampton West. I'm also a mom and a respiratory therapist. And for years, I've been on the front lines of our healthcare system in my community. I have seen firsthand the devastation of Halloween medicine. And when the pandemic hit, I worked around the clock trying to keep people breathing as they battle this terrible virus. For months, I slept in my basement when I came home, isolated from my family and loved ones to make sure I kept them safe. Every day in my work, I come up against a legacy of decades of provincial governments with the wrong priorities. Starting with Mike Hare's PCs, continue with Kathleen Wynne and Stephen Del Duca's Liberals, and going right through to Doug Fort's PCs today. These governments could have invested in the public healthcare system we all depend on so that everyone who needs care can get it. No matter where they live or how much money they make. But they weren't looking out for everyday people and their families. Instead, they chose to cut, freeze, and neglect healthcare and leave all of us to live with the devastating consequences. Which is why I'm so proud to introduce our next speaker. Andrea Horwath is working for you. Andrea listens. She cares. In her bold, progressive vision and her pragmatic, achievable plans to make it happen, I see my values. I see my priorities. I see the priorities of my community. Andrea is the only leader who can take on Doug Fort's Conservatives and send them packing this election. She is the only leader we can trust to listen to Ontarians, put everyday people first, and fix what matters most. Because people getting the care they desperately need, we just can't wait another 4 years. So everyone, please join me in welcoming the leader of the official opposition, NDP, in just 38 days, the next Prix of Ontario, Andrea Horwath.
Thanks so much, Navjeet, for the inspirational introduction. You're one of many healthcare heroes here today, and I want to thank all of you and your families for your sacrifices helping us fight COVID-19. No question, the last few years have been tough. Healthcare workers like you have been working so hard to keep up. It must break your hearts to see people waiting in pain because our healthcare system is on its knees. So many folks are working day in and day out while the cost of living keeps going up and your wages aren't. And the high cost of homes makes it harder for people to build a good life for themselves and their loved ones. For far too long, government just hasn't been working for people, and COVID really exposed that. Now, folks aren't asking for the moon and the stars. They just want someone who really gets what they're going through. And they haven't had that in a while. And we know that the good news is it doesn't have to be this way. We can fix what matters most to people. Today, I'm releasing our commitments to Ontarians. We are going to fix healthcare. We're going to reduce wait times by hiring thousands of nurses and other health professionals. We're going to improve mental health supports and bring them into OHIP so you use your health card and not your credit card. We're going to fix seniors' care. We're going to help seniors live at home longer with more home care services and get the profits out and put the care back in to home care and long-term care. We're going to tackle the cost of living. Make sure you don't have to shell out for necessities like prescription drugs and dental care. Go after speculators that are driving up housing costs for everyone else. We're going to build more affordable homes. And help folks with their down payment so they can buy their first home. Yes. We're going to control skyrocketing rents and protect tenants. And we're going to make sure that people have good jobs that pay the bills. We're going to give our kids the best public education possible and ensure that they inherit a livable planet. And so this is our vision. This is our vision to make life better for people in Ontario now and finally start to fix the things that matter most for today and for generations to come. Thank you all for being with me this morning and all the great work that you do. And now I'm happy to take any questions that the media might have.
So we'll just ask journalists to line up at the mic. It'll be one question, one follow-up. And if you could please just introduce yourself by your name and your outlet so the folks joining us on Zoom as well know who's asking the question.
We're wondering about your plans to balance the budget, if you do plan to do that within the first 4 years, and when, if you form government.
Thanks, Holly, for the question. What I can guarantee Ontarians is that we are going to be responsible with the province's treasury. I mean, it is absolutely the case that there are so many things that are broken, and I think COVID showed us the things that are broken that families rely on. So our job number one is going to make sure that we fix those things so that folks can build a good life here. Absolutely, we're always very careful about what the books look like in the province, and we will definitely be responsible in that regard. And of course, we haven't seen a budget yet, and so we don't know exactly what the numbers are at this point. But I want people to be confident that not only will we be responsible with the government's finances, but we will also be responsible in fixing the things that they need the most.
Yeah, and just on your plans to, I guess, speed up the pharmacare and dental coverage that we're expecting at some point from the federal government, do you have a timeline for when you want that coverage to be available to people, like target within a year or a couple years, if you could just kind of specify that?
Thanks, Holly. We are gonna get started right away. And we're gonna start building a formulary when it comes to prescription drugs. And if the federal government's plan is in place soon enough, then we'll be able to to do that collectively with them. If they're taking a little bit longer, we're not gonna slow down. We're gonna make sure that people have access to the prescriptions they need as soon as possible, and not dissimilar with dental. In fact, I think that we can do better, frankly, than where the federal government's headed. But certainly, people do deserve to have dental care, and it's a very expensive item. Certainly, kids under 12, absolutely, and households under 90,000, I think that's the federal plan. We think Ontario can do better, and so we're planning on being leaders on both of those fronts. We will absolutely work with the feds. But we're not going to make Ontarians wait. Who knows? 5 years from now, who knows who's going to be in government federally? We want to make sure that we're providing these things for Ontarians.
Hi, Andrea. Siobhan, CTV.
Hi, Siobhan.
You have made some very big promises, especially around hiring tens of thousands of public sector workers in the next few years. How are you proposing to pay for that? I understand you can't give us a full costing right now, but where's the money going to come from?
Well, absolutely. We are planning on doing exactly that because our healthcare system is broken and people deserve to have access to the healthcare that they need. And so, yes, that means 30,000 nurses, 10,000 PSWs. We're going to help make sure that kids in our schools get the supports they need, especially coming out of COVID. I think COVID really did show us just how broken everything is. And so when it comes to a full costing of our plan, once we see the budget, we'll be able to provide those numbers, and you'll definitely get that information before the campaign's over. So sometime during the campaign, we'll be able to provide those details.
Sense of where the money's come from. I know you mentioned making higher income Ontarians pay their fair share. Are you leaning on that alone or other sources of revenue?
First of all, I want to let people know that there is absolutely no way that we will increase taxes on lower income families and middle class families. People are having a hard enough time already. Costs are going up and people are having a hard enough time already. Having said that, the wealthiest Ontarians, the most profitable corporations, many of whom did very well during this pandemic, are going to be asked to pay their fair share. And so, as I said, these measures, as well as having a look at where the government's books are, is going to make us, give us an opportunity, I guess I should say, to make sure that we don't just throw gimmicks out there like other parties are doing, that we actually fix the fundamentals, the things that matter most to people. That's going to take some investment, and we're looking forward to being able to make sure that folks can have a more affordable life in Ontario.
Hi, Andrea. Matthew Bingley, Global News. I know you have a lot of this dependent on the budget coming out, but with the FAO saying that we're within a year of seeing balanced budgets, again, are you committing to sticking with that, or are you committing to running deficits to deliver on these programs, or in what year of your mandate would you run a balanced budget?
Well, again, those details are things that we'll be able to flesh out when we get the current government's budget, because that's how platforms work. They're always based on the budget. I can tell you whose budgets are suffering, though. The budgets of everyday families are suffering. And they're not being able to access the kinds of things they need to build a good life here. And whether that's a roof to put over your head as a renter or as someone that wants to buy their first home, or if that's someone that can't afford to stay well because they can't afford their prescription drugs. These are the kinds of things that will help families to be able to afford a better life, and that's my number one priority. For too long, governments have not taken care of those things. In fact, both the current government and the one previous had a hand in breaking all of these things that COVID showed us are broken. So our focus is going to be doing that, fixing those things. And yes, absolutely, when we have the numbers, we'll be able to give you a better picture of that question.
With the income tax freeze, how much is that program going to cost, and how can you deliver on all these lofty programs without having the revenue source?
Well, thanks for that follow-up question, Matthew. I don't think people being able to rely on a public health care system that meets our needs is lofty. And I don't think taking care of our seniors helping them age in place, and then, if necessary, making sure the long-term care that they go to meets their needs and allows them to live with dignity and quality of life. I don't think that's lofty. I think when it comes to how do we pay for these things, the problem is we're paying for not having these things. We saw over 4,000 seniors, 4,400 seniors lose their lives in COVID-19 in the most horrific ways. We can't just walk away from that and pretend it's okay, because it's certainly not okay. Seniors deserve better than that. And so that's what we are going to do. We are going to fix the things that, that we know have been broken, and it's going to cost us a little bit of money, but we're going to ask those who have the most ability to pay to do exactly that and ensure that middle income and lower income families have no increases in their taxes because they simply cannot afford it.
Hi, it's Chris Rishowie from the Toronto Star. I'm just wondering why you're releasing your platform now before you do have a full financial picture. Why not wait until the budget is released and then release your platform in full?
Thanks, Chris, for the question, and it's an important one. We decided that when Doug Ford figured he was going to kick the budget down the road by about a month, that people in Ontario deserve to know at the beginning of an election what the plans are of the various parties. And so we decided, even though we can't do the detailed math, if you will, without those numbers, it's important for people to understand where it is that we're headed, what it is that our priorities are, how we're going to get people back on their feet, back on solid ground again. And so that's why we've done this. I do want to assure folks, though, that we will have full costing at some point during the campaign once we have those numbers.
And can I ask how you settled on the $200,000 or thereabouts for the tax freeze? That seems like an awfully high income to me, but you're calling it, for low and middle income earners.
I would say a lot of folks around that household income, or rather around that personal income level, consider themselves middle class, and I think that's where we were thinking as well. Folks around $200,000 are struggling to buy a home these days. Let's face it, you could be earning $150,000, $200,000 a year and still not be able to keep up with your bills and put aside the money you want to buy your own home. So these are the kinds of things that we think about when we kind of ballpark the numbers for the income tax freeze.
Andrea, hi. Mike Crowley from CBC. What do you think in this platform actually differentiates you from the kind of stuff the Liberals are going to offer? I know they haven't released their whole platform, but this is, one could say that this has a lot of the elements in it that that fits with the Ontario Liberals.
They had 15 years, Mike. The Liberals had 15 years and they didn't fix these things. Not only did the Liberals not fix these things when they had the chance, but in fact, we recall, there was hallway medicine in Ontario when the Liberals left office. There was a $16 billion backlog of school repairs when the Liberals left office. We saw that the long-term care system was on its knees when the Liberals left office. So anything that they say now, people know how the Liberals operate. They'll say something, that they think sounds good during a campaign, but when they're in office, they just don't focus on the things that matter most to people. We'll fix that.
And then in regards to your other opponents in this election, you've had the Premier and his ministers making, billions of dollars of announcements of hospital construction, long-term care stuff this morning, announcing $1 billion more for home care. They're promising to invest in a lot of these same kind of things that you're talking about. What makes your promises different from theirs?
Well, there's a couple of things. First of all, they've decided at the last minute to start throwing these promises around when they've had the last 4 years to show people that that's not where their priority is. Doug Ford's priority has always been his buddies, and it's going to continue to be his buddies. So he can make any promise that he wants, but the evidence shows clearly whose side he's on, and that's the side of his buddies, and we've all paid the price for that, as we know. And so even with the kinds of things they're talking about today, like home care, they've had 4 years to fix our home care system, and their plan is to simply continue with the privatized model of home care and long-term care, which we know is not the best, does not provide the best quality for people, and literally takes public money and puts it in the pockets of Doug Ford's buddies. That's not what we're talking about. We're talking about investing every single public dollar in the care and quality of care of our loved ones.
Hi there. Hi there, Alan Hale from Queen's Park today. On that subject, when will we have a public long-term care system? When will that transition be done and how will it be done?
It's a really great question, Alan, and I appreciate it. One of the things that we've worked on quite a bit is the transition of our long-term care system. And what I want to do is assure families and assure residents in long-term care that we're not going to do anything that will destabilize their living conditions right now. We want to make things better, not worse. And so we're going to work hard with current operators to put together transition plans when they are the for-profit providers. And we're going to make sure that long-term care and home care are funded at a level that actually provides the 4 hours of hands-on care and long-term care that people deserve. And the confidence in the home care system, ensuring that people actually get the visits that they are supposed to get. I've heard so many stories of families who are beside themselves because the PSW, the home care provider, was supposed to show up and simply wasn't able to. That firms are double booking the staff, and it's heartbreaking for the staff knowing that they have a patient or client that they were supposed to see and they can't see that person. Meanwhile, of course, the person waiting for the service is left wondering where is the PSW, where is their home care provider. That's got to stop. This is people's daily lives. This is, the ability for people to get through their day is reliant on these services. And in fact, if we don't provide them, then their health outcomes worsen. Their health goes backwards in terms of their well-being. We can do so much better than that for people. So absolutely, we're going to do that. We do have a plan for transition, and we're hoping to get the cooperation of everyone involved, because everybody knows that the private for-profit system has not worked.
I also saw in the platform that you are promising to dig up and clean out the mercury in Grassy Narrows First Nation. Now, I've been to that community, and I'm sure the people there would like you to commit to an actual timeline today. When, after you're elected, would that begin, and when would it be finished?
No, it's a really good point, Alan, and I've been to Grassy Narrows a number of times as well, and I've watched after government makes promises not only about cleaning up the mercury, but about the health center there to help people who are dealing with the health impacts of the mercury poisoning. None of those things have happened, and we are committed to doing exactly that in partnership with the community, particularly in terms of the process. So we do know that these are traditional lands, and they are lands that this First Nation is responsible for. So we will work in partnership with them to do the cleanup work, and then, of course, to make sure that the health facility is actually built, that it's properly staffed, and that it is responsive to the needs of the community.
Seeing no further questions on site, we'll move to Zoom. First question will come from Adam Atkinson from CH News.
Hi, Andrea. How you doing?
I'm good, Adam. How are you?
I'm good, thanks. So I know you mentioned a couple times you don't have the exact financial numbers, but are you able to give us some kind of ballpark to how much your plan will cost?
Again, we're going to provide all of those details. We have some of the details we have all of the details of the various pieces to the plan. But of course, as you know, when it comes to all of the final numbers, that has to wait for the budget. But we'll send over what we have, and you can certainly have a look at that. I think folks got access to those numbers already, but we'll certainly make sure you have it.
Perfect. Thanks. And a follow-up question. How many affordable houses are you proposing that your government will build, and when do you expect to have those built by if you do win?
You know, Adam, we've watched, and of course in Hamilton we've seen the ravages of COVID-19 and how it has impacted folks who are most vulnerable in our communities. We've seen the homelessness crisis spiral out of control. And we know that market housing simply doesn't meet the needs of the most vulnerable folks in our communities. And so we have a plan that not only builds 100,000 homes, but also a plan that includes 30,000 supportive housing units. Why? Because people need to stay housed. If we provide folks with mental health challenges, who are struggling with substance use issues, providing supports for them to be able to stay housed is the way that we're going to be able to ensure that they don't revolve or end up back on the streets like a revolving door situation. That's the humane thing to do. That's the thoughtful thing to do, and that's the thing that'll help people keep a roof over their heads.
Next question comes from Colin DeMello from Global News.
Hey, Colin.
Hi, good. I just wanted to clarify, going back to the deficit question. So are you or is the NDP or an NDP government going to continue to run deficits if you elected in June?
Well, Colin, as I said, we don't have the budget numbers, and every platform is based on the budget. Doug Ford decided he was going to wait till the last minute. Maybe he thought we wouldn't be able to put a platform together if he didn't provide a budget. But we decided we were going to go ahead and put our platform together because people deserve to know what it is that the parties are planning to do, what our vision is, and what our priorities are. And I believe our priorities are people's priorities: healthcare and dental care, prescription drugs, making life more affordable, fixing our healthcare system once and for all. As I said, we will see where those numbers are at the end of the week, and then we'll get working on the difference between where the finances are at right now and the things that we think people need and deserve in this province to be fixed, and then we'll be able to provide that number. I guarantee you it will be coming. We just have to wait till we see the numbers from the government.
Right, I understand that, but I mean, this is not necessarily based on whether the government is, going to be tabling whatever they're going to be tabling. This is more just where the NDP sees itself. There are a lot of things that you guys are promising here that aren't necessarily going to be in this budget. A mental health care universal program, as an example. So, will the NDP ever balance the budget if you guys are elected in the next 4 years?
Colin, I think what you're missing is the other half of the equation. We certainly have plans to fix the things that matter most to people, and how that ends up, at the end of the day is the revenue side. So we've already talked about the fact that everyday families, middle class folks, lower income folks are not going to be paying extra in taxes. What we don't know is the numbers that the budget will have in them that talk about where the government's or the province's fiscal situation is at this point. So what's the revenues are looking like? What are the revenues looking like right now? What's the growth expectations that are going to be coming? These are numbers that the bureaucrats, frankly, at Queen's Park, and we thank them for their work. They do that work to provide information to a government, and that's how the government sets out their budget. And we don't have those numbers, Colin, and so that's why I'm saying we are definitely going to receive those numbers in short order, and we will be providing you with exactly the kind of information you're asking when we have the ability to provide those numbers.
And final question comes from Pooja Luthra from Y Media. Please go ahead.
Hi, Cujo.
Good morning. I just want to know how NDP will help immigrants to integrate and, settle in Ontario.
I'm not sure I got all your question because it was a bit crackly, but what we know for sure is many people come to Ontario to make this their home, and then they are not able to bring their family members. They are not able to work in their professions. Their international credentials are not recognized in Ontario in many fields. These are all things that can be addressed. Certainly some of the timelines around families coming to be with their loved ones that are already here are things that are more more focused on the federal issues. But having said that, we know that when people come here with so many gifts and so much to offer, we should be doing everything we can to make sure that not only can they practice in their profession and build a good life for themselves, but also that then Ontario, of course, gets the benefit of those skills and those talents.
Thank you so much. Also, apart from that, I would just like to know that instead, like apart from hiring professionals, like what other things is NDP doing, to make the healthcare system more affordable and so that it's not crippled in a way. Thank you.
Thank you, and it's a great question, and that's why a lot of our platform highlights the broken healthcare system that we all saw quite starkly during COVID. I think one of the things that COVID really did highlight is just how broken our healthcare system has become. And it's everything from our hospitals being overcrowded. Now, of course, we have people who are waiting sometimes years, we're going to be waiting years with backlogged surgeries and procedures because we didn't have the capacity to continue to provide regular care to folks when COVID was filling up the hospitals. Healthcare workers have been leaving in droves because they're exhausted, because they're disrespected by Doug Ford. One of the things we've committed to, and we'll do it right away, is scrap Bill 124. And of course, that means respectful bargaining with all our public sector employees, because they deserve good faith bargaining from their government. And we will also make sure that we are not only recruiting, but have a plan to retain healthcare workers and return some of those folks who have walked away from a profession they love, but in which they were disrespected and exhausted. And so we also know that our seniors' care system is broken. We are going to fix that. We know that people should be able to afford the prescription drugs they need because that's what will keep them well and prevent them from having to go into hospital or emergency wards, for example. Dental care. We know that people are literally showing up at emergency wards when they have pain in their mouth. That shouldn't be happening. So these are some of the things that we're focused on. There's just no doubt that Ontario can ensure that the people who live in this province have access to high-quality healthcare that they don't have to dig into their pockets to pay for. That's our commitment. That's what we're looking to do.
That's all we have time for, so I'll turn it back to you, Andrea.
Thanks very much. I want to just thank these wonderful folks again for being here, and thank all of you. This is really a high-stakes election. The stakes are really high. We need to ensure that people in this province have the fundamentals taken care of so they don't have to pay for things like healthcare and dental care, so they don't have to worry about the shape their parents are in and their loved ones in long-term care and home care, so that they can build an affordable life and get back on their feet, because that's what this province can do, and that's what we are committing to as New Democrats in this election. Thanks, everybody.